It presented as severe vomiting and pain, and it was actually so severe that there's a lot of it that I can't remember. My body has shut it out from the trauma.
It's this disfiguration. I mean, I was swollen, my lips were 5 times the size of what they are now.
You've got the burning sensation.
But sometimes it shows outside and sometimes it's just inside. Where you can't see it, you just feel it.
I experienced them from my limbs, mostly in my hands and probably my shoulders. Externally, in my hands, I'll feel the pressure first, whereas internally I'll feel like uncomfortable and have cramps and pain first.
It's not a condition to be taken up lightly, because if you do, the end result will be you will be sitting with fatalities which none of us want to experience.
When I had a facial attack and I was fearful of my throat swelling, I went to hospital. In the emergency, they had no idea how to help me or what medicine to give me or what I needed to get better.
The biggest misconceptions I've had with HAE is that it's usual swelling, it's a bee sting or an allergy.
Some of the things that triggers an attack will be weather, stress, when you're in a very stressful time.
I have had antibiotics that have triggered attacks. Any kind of trauma to the skin or pain or a bang or a bite can often trigger it.
It was triggered from estrogen. I was on a estrogen pill. And
definitely hormones. So when I ovulate or have my period, then I usually have an attack.
The most common areas affected by HAE include the limbs, the arms and hands, legs and feet, with swelling causing restrictive movement, pain, and difficulty performing normal tasks. The abdominal area, the internal organs and gastrointestinal tract, with swelling causing pain, nausea, vomiting, and diarrhea. This can be mistaken for serious abdominal complaints that need surgery. The neck and throat, with swelling causing difficulty swallowing, voice changes, hoarseness, and shortness of breath. Swelling in these areas can lead to death by choking.
If it's a good year, I'll have 12 attacks, 13. In a bad year, I'll have 40 to 50, maybe 60 sometimes, it depends. This is my sister, Althea.
This is my family.
This is my daughter, Chelsea.
My husband, Ashley. This is our daughter, Ashton, who has HAE.
I tell them every day, we must work through it as a family, and we need to take the necessary steps.
So the resources I've made use of now, recently in my life, is the medical emergency card. This just helps people know exactly what to do if I am having an attack. I have this medical bracelet, which I keep on my arm, and I point to it to the medical professionals who are helping me in an emergency.
My daughter Ashlyn have HAE, and I've informed the school due to going to the school and have a short meeting just to explain what HAE is all about and what they should look out for. And then she have her emergency card in a bag with her medical alert bracelet on her arm. But if anything should happen, the only step they should do is to get her to the ER. Current treatment options are the tranexamic acid, and then you get the FFPs in case of emergencies.
The treatment available in South Africa at the moment is definitely not sufficient to treat patients. There's not a lot of emergency treatment available, whereas overseas, I've learned through going on a global conference and meeting people, they have subcutaneous and intravenous medication that they take either prophylactically or when they have an emergency. Unfortunately, in South Africa, we don't have that available at the moment.
For the people that don't have it, that have loved ones that do have it, educate yourself about it, be part of the emergency plan.
If you have attacks and you don't know what it is, get tested as soon as possible.